let's start this morning with the latest on that COVID-19 vaccine. The number of COVID cases in this country surging right now because of that highly contagious Delta variant. Meantime, Pfizer announcing on Thursday that it plans to ask the FDA for emergency authorization this August for a third dose of the vaccine.
And that, of course, brings us to the question of whether we will need a booster shot at all in the coming months.
The FDA and CDC released a joint statement soon after Pfizer's announcement, stating that fully vaccinated Americans do not need any additional doses at this time. So what should we do? Let's bring in NBC News medical contributor Dr. Natalie Azar to break this all down. I saw this headline yesterday and I thought, oh, no, not again. Good morning to you.
Good morning. Hi, guys.
So if you got that Pfizer vaccine, let's just be simple here. What does it mean?
Short answer is if you're fully vaccinated, actually with any of the 3 vaccines in the U.S. that are approved right now, there's really no indication that you need to be boosted at the moment. As you guys pointed out in the intro, the question of will we need a booster? Maybe, maybe not. When will we need it? We don't know. Who will need it? We don't know yet. Probably older individuals, people who are immunocompromised or are on medications that can dampen the immune system will probably need a booster. But right now, we really don't have evidence that immunity is waning. We have those antibody titers that are coming down. We expect that. But remember, we have that other arm, the 2 other arms of the immune system that are ready and poised to react if you do become exposed to coronavirus. What we're really looking for, breakthrough infections that land you in the hospital, severe disease. Yeah. I'm looking for breakthrough infections that cause long COVID. And the big question that we don't have the answer to yet is if you're vaccinated but exposed to Delta, can you transmit to other people? A lot of metrics that need to be followed before we can say time to boost.
Dr. Azar, I wanted to ask you about something that I talk about with my own mom all the time. We know that those antibodies should diminish over time. We've debated, should people be going to their doctor right now to get those antibody levels checked?
So, Jacob, here I answer this question every single day in the office from various different patients of mine. And the answer that I'm giving them is this. If you are younger than the age of 65, let's say, you are not immunocompromised, you're not taking medications that can dampen your immune response to the vaccine, there really isn't much utility in checking for the spike protein. And the reason is this. We don't know what minimum level of antibody is necessary for protection. Of course, the higher the antibody titer, one can assume your protection might be greater. And as I pointed out, and many of us have pointed out numerous times, there are other parts of the immune system that are not measured in these commercial tests that are very likely providing that long, durable protection. If, on the other hand, many of our patients, we've done this research at NYU, who are on medications such as methotrexate, we know that that can actually, lessen the robustness of the immune response. And in those individuals, I am recommending checking the spike protein because it reassures me and it reassures them that they did mount at least what we hope is an adequate response.
There you go, Mom.
Yeah, there you go. You put us at ease as always. Dr. Azar, thank you for your time on this Friday. Have a good weekend.
You bet.
Thanks.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.